So when you talk about artificial intelligence, you talk about LLMs, they have done amazing work providing multilingual support to billions. I think this is the opportunity, this is the leader, this is the kind of leadership we need across the globe. So Amitabh, we want to hear from you, your views on digital health science borders and how multilingualism will play a key role. Thank you.
Yeah, good afternoon, and thank you very much for inviting me here. It was a privilege to actually talk in front of this August gathering. And of course, healthcare is a very important subject. And actually, patients and doctors can be from any geography, any language, speaking any language, and understanding any language, which actually is not borderless in some way. We in India, of course, started this Bhasha interface for India, which is called Bhashini, is a program to actually look at 5 basic problems. It looks at automatic speech recognition by the system, and that we do on multiple languages, 22 languages to start off with, as far as India is concerned. Then we do text-to-text translation, which is again currently on 36 languages, and we plan to increase it more. And then we have text-to-speech, where computer is able to speak to, or digital systems are able to speak to you. And then we have a lot of printed text which needs to be in machine-readable format, so that we are in a position to actually process it, understand it, and also disseminate it through the digital means. Having said that, when we are trying to do this, we found the use cases of the system at multiple places, and people have been using this. Number one is, of course, to disseminate information in multi-language format, in multilingual format. And that is something which is available through one of the most low-hanging fruits, which is the websites, as well as, we are looking at document translation and sometimes video translation. So these are the 3 major low-hanging fruits where these technologies are being used in various formats. But more importantly, when we moved on to the next generation of AI and thinking process, we found new use cases which are being now utilized for multiple, in multiple ways in the healthcare domain. Number one is patient-doctor consultation. A platform called eSanjeevani in India, which does about 1 billion, consultations, is basically doing, using the system to do a multilingual consultation. That means the doctor is speaking another language, while as the patient is speaking another language, and both are able to consult and discuss with each other about the symptoms as well as the, cures which can be there. So that is one use case which we are working upon. A few languages have been implemented, the others are on the way. We, of course, face the challenge of medical glossary being only in medical domain. So the models need to be further trained when we are trying to actually implement that. That's one. Second is that, we also have a challenge, we also are using the system to increase productivity at the OPD. That means the patient-doctor consultation can be automatically, uh, you know, uh, captured and then being used to fill up the electronic health record as well as create a prescription. There's something as a solution which is ambitiously being attempted by us, so that the irrespective of the language as well as irrespective of the digital divide, the doctors are able to use this system effectively in increasing the productivity. And this is something which we are trying out as of now, and we feel that we should be able to do it in all 22 languages as far as multilingual systems are concerned. The other thing which we have already done is something which, to create the discharge report using voice. So doctor can actually dictate the discharge report, and it can be, corrected. There are minor corrections which are required when you are actually giving it to the patient. So it is again an increase in productivity, which we are trying to attempt out of this system. And furthermore, we are looking at how, we can disseminate information, especially for the people who are on the other side of literacy divide in the country. through voice. That means in the sense that there are systems which are actually having, especially for mother and child systems, which are, during the pregnancy, what are the cures which are to be, or what are the preventive measures which are to be taken, are actually disseminated through voice through a website which we call as Audiopedia, and we have done that with GIZ in Germany, and those systems or those information dissemination systems are available. So all in all, we are actually, when we are trying to do this system, when we are trying to build all of this, we are realizing increasingly that although it has been translation was from one language to other, was basically taken up as one small requirement or one small value addition in the healthcare system, has now come to the center stage, because as we become borderless in digital healthcare, each one of us is supposed to understand the other person, and hence the AI models which are coming up now allows the communication between doctor and patient, doctors and doctors, and also dissemination to the other people who are in the healthcare domain, as nurses, pharmacists, and other people. These are some things which are coming up very, very well in this current, in the current phase of working which we are doing. We also are, looking at other use cases which are related to recording of birth data, because that is again one of the challenges for us, because people who are nurses are on the other side of the digital divide, and hence can voice be used as a medium to record the birth data. And that is something which has been implemented in one of the states in India, and it is across states. So, we are now concurrent in that state as far as the birth data is concerned, which was lagging behind a month or so. So these are some of the use cases which we are attempting, and we are looking for more from the healthcare domain. Of course, it will be great to collaborate across the boundaries to see how we can contribute our own small bit for the digital health scenario. So that is what I wanted to share with all of you today.
Thank you, Amitabh, so much. And it is on the strength of your work that we look at doing digital health science projects. And I must tell you, Hani is here from ITU. So, Hani, what we have done with Amitabh, this is a Government of India initiative, that we are rolled out a patient portal in 16 languages. They don't even have to type. You just speak and the system interacts with you. So it's like an AI chatbot, which is voice enabled. A great example of digital public good and infrastructure. Thanks, Amitabh, so much for your wonderful support.